Well, as the U.S. continues to struggle with new COVID cases, scientists are predicting better days ahead. More than 5.4 million cases were reported nationwide last week, but New York City, one of the first places in the U.S. hit by the Omicron variant, is recording a decline in both new cases and hospitalizations that is similar to what we are seeing in South Africa, where the strain was first detected. Debora Patta reports.
After just 8 weeks since the world first heard about Omicron, discovered here in South Africa, the country's wave has dropped as sharply as it had risen, and there's been very little interruption to people's lives. Children remain in school, restaurants are busy, and the city is bustling. Omicron quickly became the focus of global anxiety. Infections spread here with ferocious speed. Within days, South Africa was the epicenter of the disease, and then, well, not much at all.
We've monitored this same COVID ward throughout the pandemic. During the Omicron wave, it's as if it's a completely different hospital. Half empty, very few patients requiring oxygen, and the staff are under a lot less pressure.
It was the complete opposite just 6 months ago during the country's battle with the Delta variant. Then this same hospital was overwhelmed.
You are a human being before you become a nurse. So seeing people dying like that is very, very hard.
That was exhausted COVID nurse Justice Mangala speaking to us then. This time round, he can count the deaths on one hand.
A little bit at ease. Now that we have got this second line of defense, which is our vaccine.
It's the vaccine and previous infections that have boosted South Africa's immunity to the virus, explains vaccinologist Professor Shabri Ahmadi, and that has dramatically reduced severe illness and death.
The Omicron wave now accounts for less than 5% of all of the deaths that has occurred due to COVID-19 since the start of the pandemic.
Marty believes that while there will still be many more variants, the acute phase of the pandemic, at least here in South Africa, with its devastating death toll, could be over.
I'm highly optimistic that we have reached a turning point of this pandemic. I can't see us revisiting what we experienced during the course of the first 3 waves in South Africa, and in fact I'm optimistic in most other countries.
Some high-income countries have cautioned against relying too much on the South African data, but scientists like Professor Marty battle to understand their reluctance to learn from the South African experience. Vlad?
All right, Deborah, thank you very much. Dr. Susannah Hills is joining us now to discuss the latest pandemic development. She's a pediatric airway surgeon and an assistant professor of ENT at Columbia University Medical Center. Dr. Hills, good to see you.
Thanks so much for having me.
So how confident should we be that the rapid fall in case numbers Deborah reported from in South Africa, will we see something similar here, I guess?
Well, I feel particularly reassured, not only because of what we're seeing in South Africa, but because of the numbers that were reported at the end of last week from here in New York. It looks like case numbers across the state are down about 47% from last week compared with the week prior. And that's new cases. So that's a huge number. Again, the reporting is a little bit unreliable. Lots of people are testing at home. That doesn't necessarily get recorded. But if that trend continues, then we're going to see the impact on our hospitalizations and, of course, on our numbers of severe illness and death. We have to kind of monitor this and see what happens over the next week or two, and keep in mind that while case numbers decrease, the decrease in hospitalizations, people in the hospital coming out of the ICUs, and the pressure on the hospitals being relieved tends to lag the new case numbers declining. So we'll probably feel a crunch in our hospitals for several more weeks, even if the numbers are declining. But I do feel like the numbers here in New York may begin to reflect what is happening in South Africa, which would be great.
So you and I have spoken about the concerns that everybody has over the potential or the possibility of a new variant after Omicron arising. And during the World Economic Forum, Dr. Anthony Fauci spoke about this virus, Omicron, and how new variants are impacting immune response. I want to play a bit of what he had to say.
We've only eradicated one infectious disease in man, and that's smallpox. That's not going to happen with this virus. The new variants can be eluding the immune response, and we're seeing that with Omicron.
So Dr. Fauci suggesting that we're going to be stuck with this virus. Do you feel confident that the approach that our public health officials have taken and have guided us with is the one that we should be following, given that we're going to be dealing with this for a long time? I understand that science is always changing as we understand the nature of the threat. Say the science isn't changing, but our response to the changing nature of the threat is changing. It changes from time to time. Are we on the right path?
Well, I think that many pieces of the public health messaging have been right on and really useful. There has been some confusion lately with guidance from the CDC, but I think that take-homes that continue to be repeated, like the importance of vaccination, are really, really important, particularly in light of what you just mentioned and what Dr. Fauci was saying in the clip, that this virus is likely to be something that we're living with. And so we're very likely to be encountering an annual vaccine or an annual booster, to have that be part of our regular public health routine, just like we do with many other diseases, including the flu. So the focus on that, I think, is really important. Getting people comfortable with that idea, I think, is the one way we're going to transition into being able to manage this virus at a level where life continues and we can do all of the things that we're used to doing. So that has been, I think, the most important piece of public health messaging. And I think also just getting people really accustomed and familiar with the guidance to, wash your hands, to mask, to protect others around you when you're sick, I think has also been really important and useful.
So, Doctor, I don't want to diminish the pain and the suffering that folks who've become infected with Omicron have gone through, especially unvaccinated folks who have found themselves in the hospital. But for the most part, those Americans who are fully vaccinated and who have received the booster, those who've been infected with breakthrough infections, have said essentially that it's been, in some cases, difficult, but it hasn't required hospitalization. So a lot of Americans are breathing a sigh of relief, and you even have some that are saying, you see, it's just as, it's perhaps a bad cold, which is what some people have suggested all along. But my question has to do with what are we prepared if the next variant that comes down the line is closer to Delta or even deadlier than Delta? Are we prepared with all the measures that we've taken, the vaccinations that have occurred across this country, the mask wearing that most Americans continue to employ? Are we prepared for that?
I think we could be prepared. I think, the approach or where we were when this Omicron variant really picked up pace caught us off guard, and I don't think it should have. We were slow to respond as we should have with testing, in particular with Omicron. And I was really surprised that we had such a hard time getting tests initially, given that that was sort of the key factor. It's such an important factor, particularly with these highly transmissible variants, to managing the spread. So I think we know how to do these things. We have testing capacity. We need to be prepared for variants that are particularly transmissible, like Omicron, that could crop up. I think it's really probable that we'll have additional variants, and they hopefully won't be like Delta. They hopefully won't be like Omicron in their transmissibility, but they could. So we've got to be ready to have tests available for every single American repeatedly over, the course of weeks to months, to have a couple available a week. We've got to be able to have masks, surgical masks, available for the public to give them out should we have a variant that is highly transmissible like Omicron. And we've got to continue to produce vaccines and work to get our unvaccinated and unboosted folks vaccinated and boosted. The fortunate thing, hopefully coming down the line early in this year, in the next few months, maybe we'll be getting a vaccine for our youngest kids. That would be a huge benefit and a huge help to that particularly vulnerable population.
All right, Dr. Susannah Hills, always great to speak to you. Thank you very much.
Thanks, Vlad.